Ladies, today we're talking about something many women face but don't always talk about: uterine fibroids. These are non-cancerous growths that develop in the uterus, and while they are quite common, they can sometimes cause significant issues. It's important to understand what they are, how they can affect you, and what you can do about them. Uterine fibroids are very common, and they're usually not cancerous. In fact, many women have them at some point in their lives without even knowing it. They can vary greatly in size, from tiny seedlings that are undetectable by the human eye to bulky masses that can distort and enlarge the uterus. But they can cause problems for some women. Symptoms can include heavy menstrual bleeding, prolonged periods, pelvic pain, and pressure. Some women may also experience frequent urination, difficulty emptying the bladder, constipation, or backache. If you're concerned, you are in the right place. Understanding fibroids is the first step towards managing them effectively. Knowledge empowers you to make informed decisions about your health. Uterine fibroids are growths in the uterus. They can be located in different parts of the uterus, including the inner lining, the muscular wall, or on the outer surface. The location of the fibroids can influence the symptoms you experience. They develop from the muscle tissue of the uterus. These growths are made up of smooth muscle cells and fibrous connective tissue, and they can grow as a single nodule or in clusters. Imagine them like little balls of muscle inside your womb. They can be as small as a pea or as large as a melon. The size and number of fibroids can affect the severity of symptoms. Most women with fibroids don't have any problems. Many women live with fibroids without any symptoms and may only discover them during a routine pelvic exam or prenatal ultrasound. But some women have pain, bleeding, or other issues. These symptoms can be disruptive and affect your quality of life. It's important to talk to your doctor if you experience any of these symptoms. We'll talk about what causes fibroids, the symptoms, and how they're treated. There are various treatment options available, ranging from medication to manage symptoms to surgical procedures to remove the fibroids. We'll also discuss how to live with fibroids and when to see your doctor. Remember, information is power. By understanding fibroids, you can take control of your health and make the best decisions for your well-being. So, what are uterine fibroids exactly? Uterine fibroids, also known as leiomyomas or myomas, are growths that develop from the muscle tissue of the uterus. They are quite common, especially in women of reproductive age. They're non-cancerous tumors that grow in the uterus. Despite being called tumors, they are benign, meaning they are not cancerous and do not increase the risk of uterine cancer. They're made up of muscle cells and other tissues that grow excessively. This excessive growth can vary greatly in size, from very small, undetectable nodules to large masses that can distort and enlarge the uterus. Think of it like this. Your uterus is like a garden. In a healthy garden, everything grows in harmony, each plant in its place. Sometimes, extra cells grow in the garden, like weeds. These weeds can disrupt the balance and harmony of the garden, just as fibroids can affect the normal function of the uterus. These weeds are like fibroids. They are not supposed to be there, but they grow anyway, often without any apparent reason. They're not supposed to be there, but they're not always harmful. Many women with fibroids experience no symptoms and may never know they have them unless they are discovered during a routine pelvic exam or prenatal ultrasound. Fibroids can be tiny, like a seed, or as big as a grapefruit. The size of the fibroid can influence the symptoms a woman might experience. Larger fibroids can cause more noticeable symptoms, while smaller ones might go completely unnoticed. Most women with fibroids don't even know they have them, as they often cause no symptoms. However, when symptoms do occur, they can include heavy menstrual bleeding, prolonged periods, pelvic pain, and pressure. But when symptoms do appear, it's essential to understand what's going on. Knowing the signs and seeking medical advice can help manage the condition effectively and improve quality of life. We don't know exactly what causes fibroids, but hormones and genetics seem to play a role. Estrogen and progesterone are hormones that help the uterus grow during menstruation and pregnancy. Fibroids contain more estrogen and progesterone receptors than normal uterine cells. This means they might grow faster when exposed to these hormones. If your mother or sister had fibroids, you're more likely to develop them. Also, women of African descent are more likely to have fibroids than women of other races. Many women with fibroids have no symptoms. When symptoms do occur, they can vary depending on the size, number, and location of the fibroids. One common symptom is heavy menstrual bleeding. You may also experience bleeding between periods. Fibroids can also cause pelvic pain or pressure. Other symptoms include frequent urination, constipation, pain during sex, and lower back pain. Remember, these symptoms can be caused by other conditions. If you experience any of these, it's important to see your doctor. Section 5. Diagnosing uterine fibroids. Diagnosing uterine fibroids usually starts with a pelvic exam. Your doctor will feel your uterus for any abnormalities. If they suspect fibroids, they may order imaging tests. An ultrasound uses sound waves to create a picture of your uterus. This can help your doctor see the size and location of any fibroids. Another imaging test is an MRI, which uses magnetic fields and radio waves to create detailed images. These tests can help confirm the diagnosis and rule out other conditions. Section 6. Treatment options for uterine fibroids. The good news is that not all fibroids require treatment. If your fibroids aren't causing symptoms, your doctor may recommend watchful waiting. This involves monitoring the fibroids for any changes. If you're experiencing symptoms, your doctor will recommend the best treatment based on your age, symptoms, and desire for future pregnancy. Medications can help manage symptoms like heavy bleeding and pain. Surgery may be an option if other treatments aren't effective. Remember, the best treatment depends on your individual circumstances. Section 7. Living with uterine fibroids. Living with uterine fibroids can be challenging, but it's important to know you're not alone. Many women find relief from symptoms through lifestyle changes. Maintaining a healthy weight is important, as excess weight can increase estrogen levels. Regular exercise can also help regulate hormones and reduce symptoms. Eating a balanced diet rich in fruits, vegetables, and whole grains can also be beneficial. Managing stress through relaxation techniques like yoga or meditation can also improve your overall well-being. Section 8. Seeking medical advice. If you're experiencing any symptoms of uterine fibroids, don't hesitate to talk to your doctor. They can help determine the cause of your symptoms and recommend the best course of action. Early diagnosis and treatment can help manage symptoms and prevent complications. Remember, you don't have to suffer in silence. Your health is important, and seeking medical advice is a sign of strength, not weakness. Section 9. Conclusion: you are not alone. Uterine fibroids are a common condition that affects many women. These non-cancerous growths can vary in size and number, and while they can sometimes cause discomfort or other symptoms, they are often manageable with the right care and attention. While they can be concerning, it's important to remember that they are usually benign and treatable. Many women live healthy, fulfilling lives despite having fibroids. The key is to stay informed and proactive about your health. By understanding the causes, symptoms, and treatment options, you can make informed decisions about your health. Knowledge empowers you to take control and seek the best possible care. There are various treatment options available, ranging from medication to minimally invasive procedures, and even lifestyle changes that can help manage symptoms. Remember, you are not alone on this journey. Many women have walked this path before you and have found support and strength in their communities. Sharing your experiences and connecting with others can provide comfort and valuable insights. If you have any concerns, please reach out to your healthcare provider. They are there to help you navigate your health journey and provide the support and information you need. Don't hesitate to ask questions or seek a second opinion if you feel it's necessary. Take care of yourself and know that you are strong, beautiful, and capable of overcoming any health challenges that come your way. Engage in self-care practices, stay connected with loved ones, and maintain a positive outlook. Your well-being is a priority, and with the right support and mindset, you can thrive. Subscribe to our YouTube channel for more notifications and updates on health topics. Stay informed and empowered.